I'm Peter Landless. I currently direct Health Ministries for the General Conference of Seventh-day Adventists in Silver Spring, Maryland. I'm also the Chair of Adventist Professional Health and Humanitarian Services and also the Chair of the Vista Clinic Board of Trustees. Adventist Professional Health and Humanitarian Services, APHHS, has a very interesting history. It originated many years ago, in fact in the 1970s, in an organization called Adventist Medical Services, AMS. That in turn started out of the genius, I would say, of Pastor Peter Coetzee and Dr. Warren Staples. They got together and at that time Dr. Warren Staples was working for the then Black South African Union, Southern Union Conference, and at that time he was running a practice, or had been running practices, had worked at Maludi Hospital, then in Vicksburg, and then in Bethlehem, and they started an organization which would serve the Southern African Union territory. And what they wanted to do was to see health workers, health professionals, specifically physicians, dentists, and optometrists, working within the framework of the denomination. And they would serve the church at denominational salaries, running practices, and the profits of these practices were used to finance many different projects. The major goal was to start a hospital at some point in Bethlehem. Now, that never happened, but what did happen, ultimately, a psychiatric hospital was started in the area of Centurion in 1983-84, and that's where Vista Psychiatric Hospital had its beginnings. But let's go back to the very start. Prior to the formation of Adventist Medical Services, Dr. Staples, when he'd finished his medicine course, went to work first at Nokuphila and then down to Maluti and served there, specialized in eye work. But prior to doing his specialization in eye work at Moorfields Hospital in the United Kingdom, he opened a practice in Vicksburg and served not only the area of Vicksburg and ultimately, when he came back as an ophthalmologist, people from around the country and even countries further afield of South Africa, because he was such a dedicated, committed, talented surgeon. Over the years, a lot of money came in through the various dedicated practitioners who worked with AMS, which then became Adventist Health Services. It expanded and took in more specializations. We were thrilled to see people like Dr. Arnold Robenheimer, Dr. Johan Joubert, specialist obstetricians and gynecologists, and there were others. There were dentists, family physicians. I went into the organization as a family practitioner, a missionary in Vicksburg, and we had a wonderful time. But the outreach and the effects of the work which was done then and is still being done is witnessed in the fact that Vista Psychiatric Hospital continues to be a beacon, as it were, on a hill. Sadly, because of income tax restraints, also because of the Health Professionals Council no longer allowing, for the last 20 plus years, not allowing practitioners to work for another organization, for example, like I used to and Dr. Staples used to and others, work for the church, that is no longer permitted. So APHHS has turned to using the funds with which the Lord has entrusted it in the past. Prior to 1994, we were able to use money for any kind of project. Well, since then, the restraints that have been placed on the organization by the receiver of revenue are such that the monies could only be used specifically for health-related endeavors. And so the HIV and AIDS work has been strongly supported throughout the Union. For 20 years we had the privilege of sponsoring the Health Ministries and Family Ministries portfolio of the South African Union Conference. Also, there's been support of our Mission Hospital, Maluti Adventist Hospital, and numerous other health endeavours, health camps, health outreach, assistance in health situations and health needs throughout the Union. We are responsible and accountable to the receiver of revenue because of our tax-exempt status, and of course, most importantly, we are responsible to the Lord who has placed us as stewards of the funds that He has entrusted to us. But the most important thing is that APHHS, which it now is, Adventist Professional Health and Humanitarian Services, has been placed in a position where it will serve. And by God's grace, until He comes, and as long as He gives us opportunity, that's what we must do.